positive regard. Therapists create a supportive environment that encourages clients to explore their thoughts and feelings. This approach empowers individuals to gain self-awareness, make positive changes in their lives, and achieve personal growth. By fostering a genuine and accepting therapeutic relationship, person-centered counseling allows clients to feel heard, valued, and motivated to pursue their own paths to healing and self-discovery. Cognitive therapy, cognitive behavior therapy, key concepts, cognitive triad, irrational ideas, cognitive restructuring, stress inoculation treatment. Cognitive therapy, cognitive behavior therapy. Cognitive therapy and cognitive behavior therapy are therapeutic approaches developed by Aaron Beck in the 1960s. These therapies focus on how our thoughts influence our feelings and behaviors. The main idea is that by changing negative thought patterns, we can improve our emotional well-being and change our behaviors. In this guide, we will explore the key concepts of cognitive therapy and cognitive behavior therapy in simple terms, along with examples to illustrate each idea. Key concepts of cognitive therapy and cognitive behavior therapy. 1. Cognitive triad. The cognitive triad is a concept that describes the three key areas that influence a person's mental state: thoughts about oneself, thoughts about the world, and thoughts about the future. According to Beck, negative beliefs in these three areas can lead to depression and other mental health issues. Thoughts about self. How we view ourselves can significantly impact our feelings. If someone thinks, "I'm not good enough," they may feel sad and unmotivated. Thoughts about the world. This refers to how we perceive our experiences and interactions. If someone believes that the world is unfair, they may feel helpless and frustrated. Thoughts about the future. Our expectations about what will happen can affect our mood. If someone thinks things will never get better, they may feel hopeless. Example: a student who fails a test might think, "I'm a failure, I'll never succeed in school, and I'll never get into college." These negative thoughts create a cycle that can lead to feelings of depression and anxiety. 2. Irrational ideas. Irrational ideas are distorted or unrealistic beliefs that can negatively impact our emotions and behaviors. Beck identified common irrational thoughts, such as, "I must be perfect," or "If I fail, I am worthless." These thoughts are often exaggerated and do not reflect reality. Example: a person might think, "I can't make any mistakes at work, otherwise I'll get fired." This belief is irrational because everyone makes mistakes, and it is unlikely that one error would lead to losing a job. Recognizing these irrational ideas is the first step toward changing them. 3. Cognitive restructuring. Cognitive restructuring is a technique used in cognitive therapy and CBT to help individuals identify and change negative thought patterns. The goal is to replace irrational ideas with more realistic and positive thoughts. The process involves several steps. 1. Identify negative thoughts. Recognize when negative or irrational thoughts occur. 2. Challenge those thoughts. Evaluate the evidence for and against these thoughts. Ask questions like, "Is this thought true?" or "What would I tell a friend in this situation?" 3. Replace with balanced thoughts. Develop more balanced and realistic thoughts. For example, instead of thinking, "I am a failure," one might say, "I didn't do well this time, but I can learn from my mistakes and improve." Example: if someone feels anxious about public speaking, they might think, "I will embarrass myself." Through cognitive restructuring, they can challenge this thought and replace it with, "I have prepared well, and it's okay to feel nervous. I can handle this." 4. Stress inoculation treatment. Stress inoculation treatment is a technique used in CBT to help individuals prepare for and cope with stressful situations. This approach teaches people to manage stress by developing coping skills and using them in real-life scenarios. The treatment typically involves 3 phases. 1. Conceptualization. The therapist helps the client understand the nature of stress and how it affects them. They discuss specific stressors and the client's responses to them. 2. Skill acquisition and rehearsal. Clients learn and practice coping skills, such as relaxation techniques, positive self-talk, and problem-solving strategies. These skills help them handle stress more effectively. 3. Application and follow-through. Clients apply the learned skills in real-life situations. The therapist may encourage them to gradually face stressors, starting with less challenging situations and working up to more difficult ones. Example: a student who experiences anxiety before exams might use stress inoculation treatment. They learn relaxation techniques and practice positive self-talk. When exam day arrives, they can use these skills to manage their anxiety effectively. Conclusion: cognitive therapy and cognitive behavior therapy are powerful approaches that focus on understanding and changing negative thought patterns to improve emotional well-being. By exploring concepts like the cognitive triad, irrational ideas, cognitive restructuring, and stress inoculation treatment, individuals can learn to manage their thoughts and feelings more effectively. These therapeutic techniques empower individuals to recognize negative thinking, replace it with more positive beliefs, and develop coping skills to handle stress. Ultimately, cognitive therapy and CBT help people lead healthier, happier lives by fostering self-awareness and personal growth. Rational emotive behavior therapy key concepts: ABC theory of personality, rational versus irrational beliefs. Rational emotive behavior therapy. Rational emotive behavior therapy is a type of cognitive behavioral therapy developed by psychologist Albert Ellis in the 1950s. This approach focuses on helping individuals identify and change irrational beliefs that lead to emotional distress and unhealthy behaviors. REBT emphasizes the connection between thoughts, emotions, and behaviors, and it teaches individuals how to think more rationally to improve their mental health. In this guide, we will explore the key concepts of REBT in simple terms, along with examples to illustrate each idea. Key concepts of REBT. 1. ABC theory of personality. The ABC theory of personality is a fundamental concept in REBT that explains how our thoughts influence our emotions and behaviors. The ABC stands for A. This is the event or situation that triggers a response. It can be anything from a stressful situation to a negative comment from someone. B. These are the thoughts or beliefs we have about the activating event. According to REBT, our beliefs play a crucial role in determining how we respond emotionally to the event. C. These are the emotional and behavioral responses that result from our beliefs about the activating event. The key idea of the ABC model is that it is not the activating event itself that causes our emotional response, but rather our beliefs about that event. Example: let's say a student receives a low grade on a test. A. The student gets a low grade on a math test. B. The student thinks, I'm a failure because I didn't get an A. I'll never succeed in math. C. As a result of these beliefs, the student feels anxious and discouraged, and they may avoid studying for future math tests. By recognizing this pattern, the student can learn to challenge their beliefs and change their emotional response. 2. Rational versus irrational beliefs. In REBT, beliefs are categorized into two types: rational beliefs and irrational beliefs. Understanding these two types of beliefs is crucial for emotional well-being. Rational beliefs. These are beliefs that are logical, flexible, and based on reality. They help individuals cope with challenges and lead to healthier emotional responses. Rational beliefs encourage self-acceptance and realistic expectations. Example: a rational belief would be, I didn't do well on this test, but I can learn from my mistakes and improve next time. This belief allows the student to focus on growth rather than self-judgment. Irrational beliefs. These are beliefs that are rigid, unrealistic, and often lead to negative emotions. Irrational beliefs can create unnecessary stress, anxiety, and feelings of inadequacy. Common irrational beliefs include the need for perfection, the belief that others must treat us fairly, and the idea that we should always be happy. Example: an irrational belief would be, I must get an A on every test to be considered a worthwhile person. This belief sets an unrealistic standard and can lead to feelings of failure and anxiety. Challenging irrational beliefs. REBT teaches individuals to identify their irrational beliefs and challenge them. This process involves questioning the validity of these beliefs and replacing them with more rational and constructive thoughts. Example: if a client holds the irrational belief, I must be loved by everyone, the therapist might help them reframe this thought to, it's okay if not everyone likes me. What matters is that I have healthy relationships with those who care about me. This shift in thinking can lead to greater emotional stability and self-acceptance. Conclusion. Rational emotive behavior therapy, developed by Albert Ellis, provides a powerful framework for understanding the relationship between thoughts, emotions, and behaviors. By using the ABC theory of personality, individuals can identify how their beliefs about activating events influence their emotional responses. Understanding the difference between rational and irrational beliefs is crucial for emotional health. By challenging irrational beliefs and replacing them with rational ones, individuals can improve their mental well-being and lead happier, more fulfilling lives. REBT empowers people to take control of their thoughts and emotions, fostering resilience and personal growth. Eclectic Integrative Counseling. Eclectic Integrative Counseling. Eclectic Integrative Counseling is a flexible approach to therapy that combines techniques and strategies from different therapeutic models and schools of thought. Instead of sticking to one specific method, therapists who practice eclectic or integrative counseling draw on a variety of theories and techniques to meet the unique needs of each client. This approach recognizes that no single therapy works for everyone, and that individuals may benefit from a combination of methods. Key concepts of eclectic integrative counseling. 1. Flexibility. One of the main features of eclectic counseling is flexibility. Therapists assess each client's specific issues, personality, and preferences, and then tailor their approach to best suit that individual. This means that the therapist can switch techniques and strategies depending on what works best in each situation. Example: if a client is struggling with anxiety, the therapist might start with cognitive behavioral techniques to help the client challenge negative thoughts. If the client also needs emotional support, the therapist might incorporate elements of person-centered therapy, focusing on empathy and creating a safe space for the client to express their feelings. 2. Combining theories. Eclectic counseling involves combining theories from various therapeutic approaches. Some common therapeutic models that may be integrated include: cognitive behavioral therapy focuses on changing negative thought patterns and behaviors. Humanistic therapy emphasizes personal growth and self-actualization, highlighting the importance of empathy and understanding. Psychodynamic therapy explores unconscious processes and childhood experiences to understand present behavior. Gestalt therapy focuses on awareness of the present moment and personal responsibility. Example: a therapist might use psychodynamic techniques to help a client explore past experiences that influence their current behavior, while also incorporating CBT strategies to help them develop healthier thought patterns. 3. Client-centered approach. In eclectic counseling, the client-centered approach is crucial. The therapist prioritizes the client's needs and preferences, ensuring that the therapeutic process is collaborative. This means that the therapist actively involves the client in decision-making regarding their treatment. Example: if a client expresses interest in mindfulness practices, the therapist might integrate mindfulness techniques alongside traditional therapy methods. By considering the client's input, the therapist creates a more personalized and effective treatment plan. 4. Assessment and evaluation. Effective eclectic counseling requires assessment and evaluation of the client's progress. Therapists continuously monitor how different approaches are working and adjust their methods accordingly. This ongoing evaluation helps ensure that the client is receiving the most beneficial support. Example: after several sessions, a therapist might ask the client how they feel about the techniques being used. If the client finds cognitive behavioral exercises helpful but struggles with other methods, the therapist can modify the approach to focus more on what works best for the client. 5. Emphasis on strengths. Eclectic counseling often involves recognizing and utilizing the strengths of the client. Instead of focusing solely on problems, therapists help clients identify their skills and resources, empowering them to overcome challenges. Example: if a client is dealing with stress at work, the therapist might help them recognize their organizational skills or ability to connect with colleagues. By emphasizing these strengths, the therapist encourages the client to use their abilities to manage stress more effectively. Conclusion: eclectic integrative counseling is a versatile and adaptive approach to therapy that combines various techniques and theories to meet the unique needs of each client. By emphasizing flexibility, combining different therapeutic methods, focusing on the client's preferences, and continuously evaluating progress, therapists can provide personalized and effective support. This approach recognizes that individuals have diverse experiences and challenges, and that a one-size-fits-all method may not be effective. By tailoring the therapeutic process to each client, eclectic counseling empowers individuals to explore their thoughts and feelings, develop coping strategies, and work toward personal growth and healing. Professional and ethical topics. ACA Code of Ethics, Scientific Foundation for Techniques, Therapeutic Relationship, Licensing, and Professional Organizations, Consultant Ethical Responsibilities. Professional and ethical topics in counseling. Understanding professional and ethical topics is essential for anyone pursuing a career in counseling. These topics guide counselors in their practice, ensuring that they provide effective and ethical care to their clients. In this guide, we will explore key concepts such as the ACA Code of Ethics, the Scientific Foundation for Techniques, the Therapeutic Relationship, Licensing and Professional Organizations, and Consultant Ethical Responsibilities. 1. ACA Code of Ethics. The ACA Code of Ethics is a set of guidelines established by the American Counseling Association to help counselors navigate ethical issues in their practice. This code outlines the professional standards for counselors and serves as a framework for ethical decision-making. Key principles include respect for clients. Counselors must treat clients with dignity and respect, honoring their rights and autonomy. Confidentiality. Counselors are required to keep client information private, disclosing only with consent or when there are legal or safety concerns. Competence. Counselors should provide services only within their areas of expertise and engage in ongoing education to maintain their skills. Integrity. Counselors must be honest and transparent in their professional dealings and avoid any actions that could harm clients or the profession. Example: if a counselor is approached by a client who is struggling with substance abuse, the counselor must ensure they have the necessary training to provide effective treatment. If they're not qualified, they should refer the client to someone who specializes in addiction counseling. 2. Scientific Foundation for Techniques. Counseling techniques should be based on sound scientific principles and research. This ensures that the methods used are effective and backed by evidence. Counselors must stay informed about the latest research in psychology and counseling to provide the best possible care. Evidence-based practices. These are therapeutic approaches that have been tested and proven effective through research. Counselors should rely on these practices to help clients achieve their goals. Example: if a counselor is using cognitive behavioral therapy, they should be familiar with the research supporting its effectiveness for treating anxiety and depression. This knowledge helps them apply the techniques effectively with clients. 3. Therapeutic relationship. The therapeutic relationship is the professional bond between the counselor and the client. This relationship is crucial for effective counseling, as it creates a safe and supportive environment for clients to explore their thoughts and feelings. Key elements of a strong therapeutic relationship include trust. Clients must feel safe and confident that their counselor has their best interests at heart. Empathy. Counselors should strive to understand and share the feelings of their clients, demonstrating compassion and support. Genuineness. Counselors need to be authentic and transparent in their interactions, allowing clients to feel comfortable being themselves. Example: if a client shares a painful experience during a session, an empathetic counselor might respond with understanding and validation, saying, "It sounds like that was really difficult for you. I'm here to support you as you work through these feelings." 4. Licensing and professional organizations. Licensing is a crucial aspect of the counseling profession. Most states require counselors to obtain a license to practice, which ensures that they have met specific educational and training requirements. Licensing protects clients by ensuring that counselors are qualified to provide care. Professional organizations. Organizations like the American Counseling Association and the National Board for Certified Counselors provide resources for counselors, including continuing education, advocacy, and networking opportunities. Example: a counselor may need to complete a master's degree in counseling, gain supervised experience, and pass a licensing exam to become a licensed professional counselor in their state. This process ensures that they are prepared to provide ethical and effective care. 5. Consultant ethical responsibilities. Counselors have ethical responsibilities not only to their clients, but also to their profession and society. This includes consultation. Counselors may seek consultation from colleagues or supervisors when faced with challenging cases or ethical dilemmas. This collaboration helps ensure that clients receive the best possible care. Ethical decision-making. Counselors must be prepared to navigate ethical dilemmas using a structured decision-making process. This often involves considering the ACA Code of Ethics, the best interests of the client, and the potential consequences of their actions. Example: if a counselor is faced with a situation where a client expresses thoughts of self-harm, they must evaluate their ethical responsibilities. They may consult a supervisor to determine the best course of action while ensuring the client's safety. Conclusion. Understanding professional and ethical topics is essential for successful counseling practice. The ACA Code of Ethics provides guidelines for ethical behavior, while a solid scientific foundation for techniques ensures effective therapy. Building a strong therapeutic relationship fosters trust and openness, and licensing protects clients by ensuring that counselors are qualified. Additionally, counselors have ethical responsibilities to consult with colleagues and make informed decisions for the well-being of their clients. By adhering to these principles, counselors can provide compassionate and effective care while maintaining the integrity of the profession. Specific cases and examples. Little Hans, Little Albert, Anna O. Daniel Paul Schreiber. Various case examples illustrating psychological concepts. Specific cases and examples in psychology. In psychology, specific case studies often help illustrate various concepts and theories. Here, we will discuss 4 well-known cases: Little Hans, Little Albert, Anna O., and Daniel Paul Schreiber. Each of these cases provides insight into different psychological theories and principles. 1. Little Hans. Little Hans was a case studied by Sigmund Freud, the founder of psychoanalysis. Hans was a young boy who developed a fear of horses. Freud used Hans's case to illustrate his theories about childhood development and the Oedipus complex. Key concepts. Oedipus complex. This is the idea that a boy feels a subconscious desire for his mother and rivalry with his father. Fear of horses. Freud believed that Hans's fear of horses was a symbol of his fear of his father. The horses represented the father's authority and power. Example: Little Hans was about 5 years old when he began to fear horses, worrying that they would bite him. Freud suggested that this fear was not really about horses, but was a way for Hans to express his feelings about his father. According to Freud, Hans was experiencing anxiety related to his feelings for his mother and his fear of his father. This case helped Freud explain his theories about how childhood experiences shape our adult psychology. 2. Little Albert. Little Albert was a famous experiment conducted by John B. Watson and Rosalie Rayner in 1920. This study is primarily known for demonstrating classical conditioning, a learning process where neutral stimulus becomes associated with a response. Key concepts. Classical conditioning. This is a learning process where a person develops a response to a stimulus that previously did not elicit that response. Fear response. The experiment showed how emotions, like fear, can be conditioned. Example: in the experiment, little Albert was a 9-month-old baby who was not afraid of animals. Watson and Rayner presented a white rat to Albert, while simultaneously making a loud, frightening noise. After several pairings, Albert began to cry and show fear whenever he saw the rat, even without the loud noise. This demonstrated that Albert had learned to associate the rat with fear. This case illustrates how fear can be conditioned and unconditioned responses can be learned through experiences. 3. Anna O. was the pseudonym for Bertha Pappenheim, a patient of Sigmund Freud's colleague Joseph Breuer. Her case is one of the foundations of psychoanalysis and the development of talk therapy. Key concepts. Talking cure. This concept suggests that discussing one's thoughts and feelings can lead to healing and emotional relief. Repressed memories. Anna O. experienced symptoms that were believed to be caused by unresolved psychological conflicts and repressed memories. Example: Anna O. suffered from various symptoms, including paralysis and hallucinations. Brewer used a method called catharsis, where Anna would talk about her feelings and experiences. As she discussed her repressed memories, her symptoms began to improve. This case demonstrated the importance of exploring and expressing emotions as a way to treat psychological issues. It laid the groundwork for the practice of psychotherapy. 4. Daniel Paul Schreiber. Daniel Paul Schreiber was a German judge who became known for his detailed account of his mental illness in his memoirs. His case is often cited in discussions of schizophrenia and the nature of delusions. Key concepts. Delusions. These are false beliefs that are strongly held despite evidence to the contrary. Schizophrenia, a severe mental disorder characterized by disturbances in thought, perception, and behavior. Example: Schreiber experienced profound delusions, believing that he was being transformed into a woman and that he was receiving messages from God. He described his experiences in his book, Memoirs of My Nervous Illness, where he detailed his thoughts on reality, religion, and his mental state. Schreiber's case has been analyzed by various psychologists, including Sigmund Freud, who used it to explore the nature of delusions and the relationship between mental illness and personal experience. Conclusion. These specific cases, Little Hans, Little Albert, Anna O., and Daniel Paul Schreiber, illustrate important psychological concepts and theories. They provide insight into classical conditioning, the significance of childhood experiences, the effectiveness of talk therapy, and the complexities of mental illness. Understanding these cases helps us grasp how psychological principles apply to real-life situations and the development of therapeutic approaches. Miscellaneous topics. NCE CPC Statistics and Research Methodology Career Counseling Resources Myers-Briggs Type Indicator Thematic Apperception Test General Semantics Cognitive Triad of Depression. Miscellaneous topics in counseling. In the field of counseling, there are several important topics that professionals should be familiar with. These include the National Counselor Examination and the Counselor Preparation, Comprehensive Examination, Statistics and Research Methodology, Career Counseling Resources, personality assessments like the Myers-Briggs Type Indicator and Thematic Apperception Test, and concepts like general semantics and the Cognitive Triad of Depression. This guide will explain these topics in simple terms. 1. NCE CPC. The National Counselor Examination and the Counselor Preparation Comprehensive Examination are important assessments for aspiring counselors. NCE. This is a standardized exam that tests the knowledge and skills necessary for effective counseling. Passing the NCE is often required for licensure as a professional counselor in many states. It covers various topics, including human growth and development, social and cultural foundations, helping relationships, and group work. CPC. This exam is designed for students in counselor education programs. It assesses students' understanding of key counseling concepts and is often used as a graduation requirement. The CPC covers similar content areas as the NCE, but is typically shorter and focused on the academic setting. Example: a graduate student in counseling may take the CPC before completing their degree. After graduation, they would then prepare for the NCE to become licensed as a professional counselor. 2. Statistics and Research Methodology. Statistics and research methodology are essential tools in the field of counseling and psychology. They help professionals understand research findings and apply them to practice. Statistics. This involves collecting, analyzing, interpreting, and presenting data. Counselors often use statistics to evaluate the effectiveness of treatments, understand trends in mental health, and make informed decisions. Research methodology. This refers to the systematic approach to conducting research. It includes designing studies, selecting participants, and choosing appropriate methods to collect data. Understanding research methodology helps counselors critically evaluate studies and apply findings to their work. Example: a counselor may use research findings to determine which therapeutic approaches are most effective for treating anxiety. By understanding statistics, they can make sense of data and use it to improve client outcomes. 3. Career counseling resources. Career counseling resources provide valuable information for individuals seeking guidance on career choices. Two key resources are ONET. This is a comprehensive database that provides detailed information about various occupations, including job duties, skills required, work conditions, and salary ranges. ONET helps counselors guide clients in exploring career options based on their interests and skills. DOT. Although it is an older resource, the DOT is a reference tool that categorizes jobs and provides information about job requirements and tasks. While ONET has largely replaced the DOT, it can still be useful for understanding traditional job classifications. Example, a career counselor might use ONET to help a client explore potential careers based on their personality type and interests. They can look up information about different jobs and discuss which ones align best with the client's goals. 4. Myers-Briggs Type Indicator and Thematic Apperception Test. Myers-Briggs Type Indicator and Thematic Apperception Test are both personality assessments used in counseling. MBTI. This assessment categorizes individuals into one of 16 personality types based on their preferences in 4 areas. 1. Extroversion versus introversion. 2. Sensing versus intuition. 3. Thinking versus feeling. 4. Judging versus perceiving. Understanding one's MBTI type can help individuals recognize their strengths, weaknesses, and preferred ways of interacting with the world. TET. The Thematic Apperception Test is a projective psychological test that involves showing individuals ambiguous images and asking them to create a story about what they see. The stories reveal insights into a person's emotions, motivations, and social interactions. Example, a counselor might use the MBTI to help a client understand their personality type and how it affects their relationships and career choices. Alternatively, they might use the TAT to explore deeper emotional issues or conflicts that the client may not be fully aware of. 5. General semantics. General semantics is a field that studies how language and symbols influence human behavior and thought processes. It emphasizes the importance of clear communication and understanding the limitations of language in conveying meaning. Key concepts. Language as a tool. General semantics suggests that language shapes our perception of reality. Misunderstandings can arise when words are interpreted differently by different people. Awareness. Being aware of how language affects our thoughts can help us communicate more effectively and avoid conflicts. Example, a counselor might teach clients about general semantics to help them recognize how certain words can trigger emotional responses. By using clearer, more precise language, clients can improve their communication skills and relationships. 6. Cognitive triad of depression. The cognitive triad of depression is a concept developed by Aaron Beck, which identifies 3 negative thought patterns that contribute to depression. 1. Negative views of oneself, believing that one is worthless or inadequate. 2. Negative views of the world, seeing the world as a hostile place where bad things happen. 3. Negative views of the future, expecting that things will never change or improve. Key concepts. Cognitive distortions. These are irrational or exaggerated thought patterns that can lead to feelings of hopelessness and despair. Example, a person feeling depressed may think, "I will never be good at anything, everyone I know is against me, and things will only get worse." Cognitive therapy aims to help individuals challenge and change these negative thoughts to improve their mood and outlook on life. Conclusion. Understanding these miscellaneous topics in counseling is crucial for aspiring counselors. The NCE and CPC are important assessments that help ensure competency in the field. Knowledge of statistics and research methodology enables counselors to apply evidence-based practices. Career counseling resources like ONET and the DOT assist clients in exploring career options. Personality assessments like the MBTI and TAT provide insights into individual differences, while concepts like general semantics and the cognitive triad of depression help counselors address communication issues and cognitive distortions. By familiarizing themselves with these topics, future counselors can enhance their skills and better support their clients. General topics and exam tips. Counseling and helping relationships examination strategies, importance of research in counseling, key terms and definitions, stress management, career development, general topics and exam tips for counseling. As you prepare for the CPC exam and develop your counseling skills, it's important to understand several general topics related to counseling, effective examination strategies, the significance of research, key terms and definitions, stress management techniques, and career development. This guide will break down these topics in a way that's easy to grasp. 1. Counseling and helping relationships. Counseling is a professional relationship that focuses on helping individuals explore their thoughts, feelings, and behaviors to promote personal growth and problem solving. Key elements of counseling and helping relationships include trust. Building a trusting relationship is essential. Clients should feel safe to share their thoughts and emotions without fear of judgment. Empathy. Counselors must genuinely understand and share the feelings of their clients, showing compassion and support. Active listening. This involves fully focusing on what the client is saying, understanding their message, and responding thoughtfully. Example: a counselor helping a student with anxiety will first build trust, listen actively to their concerns, and show empathy by acknowledging how difficult it is for the student to manage their feelings. 2. Examination strategies. Preparing for exams like the National Counselor Examination and the Counselor Preparation Comprehensive Examination requires effective strategies. Here's some tips. Understand the format. Familiarize yourself with the exam structure, types of questions, and time limits. Knowing what to expect can reduce anxiety. Study regularly. Create a study schedule that breaks down the material into manageable sections. Consistent studying over time is more effective than cramming. Practice tests. Take practice exams to assess your knowledge and get used to the timing and question style. Review your answers to understand where you need improvement. Join study groups. Collaborating with peers can enhance understanding and retention of material. Discussing concepts with others can also provide different perspectives. Example: if you're preparing for the NCE, you might set aside an hour each day to review key topics, take a practice test every 2 weeks, and discuss difficult concepts with classmates. 3. Importance of research in counseling. Research plays a crucial role in counseling as it helps professionals understand effective practices and interventions. Here's some key points. Evidence-based practice. Counselors should use techniques and approaches that have been proven effective through research. This ensures better outcomes for clients. Staying informed. Regularly reviewing research helps counselors stay updated on new findings, treatment methods, and trends in mental health. Informed decision-making. Research allows counselors to make informed choices about the best strategies and interventions for their clients. Example: a counselor might read recent studies on cognitive behavioral therapy for anxiety to better understand its effectiveness and learn about new techniques that can be incorporated into their practice. 4. Key terms and definitions. Familiarizing yourself with key terms and definitions is essential for success in counseling. Here are a few important terms. Confidentiality, the ethical duty of counselors to protect the privacy of their clients' information. Empathy, the ability to understand and share the feelings of others. Cognitive behavioral therapy, a type of therapy that focuses on changing negative thought patterns to improve emotions and behaviors. Transference, when clients project feelings and attitudes from past relationships onto the counselor. Example: knowing the definition of confidentiality is critical for understanding ethical guidelines in counseling, as it helps ensure that clients feel safe discussing personal issues. 5. Stress management. Managing stress is vital for both counselors and their clients. Here's some effective stress management techniques. Mindfulness. Practicing mindfulness involves focusing on the present moment without judgment. Techniques include meditation, deep breathing, and yoga. Time management. Organizing tasks and prioritizing responsibilities can reduce feelings of overwhelm. Physical activity. Regular exercise can help reduce stress and improve mood. Even simple activities like walking can be beneficial. Social support. Talking to friends, family, or colleagues can provide emotional support and help alleviate stress. Example: a counselor might teach clients mindfulness techniques to help them cope with anxiety, encouraging them to practice deep breathing exercises when they feel overwhelmed. 6. Career development. Understanding career development is important for aspiring counselors. Here are some key aspects. Self-assessment. Identifying your strengths, interests, and values can help guide your career path. Consider what areas of counseling resonate with you the most. Networking. Building professional relationships with other counselors and mental health professionals can open doors for job opportunities and collaboration. Continuing education. Engaging in lifelong learning through workshops, certifications, and advanced degrees can enhance your skills and career prospects. Job resources. Familiarize yourself with resources like ONET and the Occupational Outlook Handbook, which provide information on job outlooks, salaries, and required qualifications. Example: a student interested in school counseling might seek internships in educational settings, network with school counselors, and attend workshops related to child psychology to enhance their career prospects. Conclusion. Understanding these general topics and tips for exam preparation is essential for success in the field of counseling. Building strong, helping relationships. Employing effective examination strategies. Appreciating the role of research. Familiarizing yourself with key terms. Managing stress, and planning for career development are all crucial components of your journey as a counseling professional. By focusing on these areas, you can enhance your knowledge and skills, making you better prepared for the CPC exam and your future career in counseling.